I'm Dr. Kiran S Chouka, sports medicine, joint replacement and orthopedic surgeon. I have been practicing sports medicine, arthroscopic surgeries, joint replacement surgeries since last 11 to 12 years. I have operated more than 4 to 5,000 surgeries. Among that, I have done more than 1,000 knee replacement surgeries. Today, I'm here to talk about joint replacement surgeries. Well, we just get X-rays done. Once it is diagnosed that the patient has severe osteoarthritis, when that is the bone-on-bone disease is there, we suggest the patient to have the knee replacement surgery. And the other criteria what I look is, I ask my patients whether they are able to walk for more than a kilometer. If they are able to do that thing, then I can postpone it. If they are not able to do it for more than 1 kilometer and they are finding it difficult to climb stairs up and down comfortably, they are having this waddling gait, they walk in this duck-like fashion, then they are dependent on medicines because of knee pain for every day, at least for 3 months or alternate days. Some people, they come to me asking that they take every second day. Once they are dependent on medicines to get relieved of this pain, I suggest them the knee replacement surgery. Basically, we get an investigation done and then we go according to that thing, and even we look at the age of the patient and then we decide for the knee replacement surgery.